Well, hello, everybody, and welcome back to episode 18 of CCA's Medical Minute podcast. We had a little bit of change in gears this week. We were going to talk about my test results that we would have gotten back from Caris Life Sciences. We did get those back, and the report was littered with an acronym that is called QNS. That meant quantity not sufficient.
Very good.
Yeah, redo. So
do over.
Well, would have been. I thought we were going to be redoing my biopsy, which would have been a blast. But as it turns out, there was some remaining tissue at the hospital, and so they did send that apparently yesterday. And so hopefully in the next another 17 days, maybe I'll know where things stand. So
not a setback.
Not a setback.
Just making sure.
Just a delay.
It's just it's a good that I'm a patient guy. I'm a really patient guy.
I like to say that what is perceived to be setback could be a setup for better outcome.
There we go. All right. Glass half
Glass half full.
Water bottle half full. Okay, so lots of excitement here in the studio this week. So we've got we're sitting at our new half moon shaped table, which does feel better. It does feel roomier.
Yes.
Courtesy of Chris, the videographer and interior designer. We have 2 new cameras. I don't know what that's going to do for us, but a lot, I think.
Just keep looking straight.
Just keep looking that way. Okay, so we got 2 new cameras, so that is good. So we keep getting fancier and fancier. We have an on-air sign. Is that on right now? It is on? Okay, cool.
Where's that at?
All right, so the passersby know that we're in here. That's good. Instead of knocking on the door. We got a clock. We have a fancy clock that I'm looking at right now. So we can try to do a better job of staying on track. But there is angst in the air.
Yes.
And that's due to the curtain that's behind me. There is controversy over this curtain. So there's talk. Well, there's talk of wanting to put greenery in here. I like the curtain, but not everybody likes the curtain.
Are we still talking about Grandma's fern?
Yeah, pretty much.
Okay, look, I know Chris is like, let's get it on because the clock is ticking.
I mean, people, this is the behind the scenes stuff. People love this kind of stuff.
Well, so what we would like to do is we would like to take a poll. So anybody that thinks that we need Grandma's fern behind Steve, let us know, comment on our posts, or if you think that the nice shade of tealy sage-ish curtain is good, let us know. We value any input.
That's right.
And speaking of input, we had some questions from the last Medical Minute that we did. Tina, and we're going to jump into answering Tina's question.
I think that we're good. So Tina basically sent us a question and was asking about the long-term effects of chemotherapy and radiation. And so we got a pretty good group put together to talk about that. The only problem with that is that it's an extensive topic. Yeah. So we wanted to acknowledge Tina's question and let her know that it has inspired us to put together an entire episode on that. Yeah. And we may even bring in some local thought leaders. There's a local company that we know that's working on developing a drug that could benefit, say, for example, neuropathy, which is a common problem.
Yeah, I'm still dealing with neuropathy, and I'm like 2.5 years out, and even chemo brain is still. Yeah. There are days that I am like, hitting on all cylinders, and there are days that I'm thinking, what did I just say, or what did I come in here for? Right, and some folks like to think that that's a function of age as well, but I'm actually a lot younger than. But chemo brain is very real. The neuropathy is still an issue. Even right now, I'm having some issues just with some sensation in my fingers and body aches, things of that nature that are kind of some of the long-term effects that you deal with after having chemo and also radiation.
Yeah.
Right.
Yeah. So Tina, we're going to get to you, and it'll be good. Trust me. So we're going to get into the topic real quick. I wanted to apologize for my lack of preparedness, which caused Jill a little bit of angst. But I got to thinking about why do I feel tired and why am I unprepared? And so I made a little list of just some things that I've had in the last week.
Okay.
Have you not drank enough water today?
I have been drinking water. I have been drinking water. But we adopted a rescue dog.
Yes.
I met with my new medical oncologist. We hosted a 200-person event with Pete Rose.
Oh, yeah. It was great.
I drove to Louisville and back to get a bourbon bottle signed for the golf outing.
Yes.
I spent all day watching the Super Bowl on Sunday, of course.
And that's exhausting.
Yeah, it was a one day. I started on a new cancer drug. I started a blog that I'm having fun with. And I spent 2 days passing a kidney stone.
Wow. You did?
Yeah. So that was that made me a little tired.
That's a lot.
It was a lot. It was a big week. Okay. And you just flew in from North Carolina. So
I did. 4 cities in 2 days.
Yep. So the long way of just explaining why we look so disjointed, and putting disclaimers out there in case this is bad.
This is a very important month, though.
It is.
I mean, all months are important.
Yes.
But this one, prevention,
National Cancer Prevention Month.
Yeah.
Yep, exactly.
So we get to talk about all of those tests that everyone prefers to put off and not prioritize because they're not very much fun.
Yep.
And there are a lot of tests. I mean, everything from, the mammograms that we have on the schedule every year annually to different prostate exams. There are more. There are lobular, oscular lymphoma, ocular lymphoma exams for the eyes, even dental screenings.
Yep. No, it's exactly right.
Just to name a few.
Yeah, no, that's exactly right. And so, of course, the best cancer is no cancer at all.
Correct.
Second best cancer is one caught early.
Absolutely.
All right, so that's what we'll touch on today. So, so Jill, why don't you walk us through? Because if you remember right, when we first put together some questions we might cover with this podcast, one of the things we talked about, one of the things I remember being on the list, was why the cancer screening guidelines had dropped for colorectal cancer. I think it's 45 now.
It is now 45.
Okay. So you want to talk about that a little bit?
As far as, and I think a lot of it is, over time, what we tend to do is we watch where the incidence is occurring. And so when you start seeing patients who are younger than 50 developing colon cancer, then you start realizing that, hey, maybe we need to be screening sooner. Yeah. And that's what happened. And so they identified that 45 was more of the optimal age instead of 50. So those colonoscopies, you get them starting at age 45. If everything's fine, they're still only once every 10 years. So you get it out of the way, you knock it out, and you be done with it. I do have some patients that will come in and say, well, what about the Cologuard?
Oh, wow.
Is that equally as effective? And the answer to that is no. The Cologuard is a good test. It does detect if there is any blood in the stool, which would obviously indicate a problem. Cologuards are used for people who a colonoscopy is not a great option. So if there is a reason why they should not be sedated, or a reason why doing the prep it puts them at high risk for another issue, then the Cologuard is offered. It is not intended to substitute or be equally as effective as the colonoscopy.
Gotcha. So, I mean, I wonder if you are USPS or UPS and you see that box on the front porch, do you just keep driving?
No, you don't.
All right.
No hazmat suit required.
No.
All right, so want to do a little bit of lightning round on some of the other things too, as far as kind of the guidelines and things. So, what's the latest and greatest on mammograms?
So mammograms, the recommended screening age is still age 40. However, if you have a strong family history, if you have any of the genetic risk, like the BRCA1 or 2 mutations, that would put you at higher risk for developing breast cancer. If you've had a significant amount of women in your family who have developed breast cancer at an early age, then that age 40 is no longer a set in stone age. And then they will do them earlier. Women who have fibrocystic breast disease, they also are at higher risk. So they tend to do those mammograms earlier. So 40 is the recommendation if you have no other risk factors.
Yeah.
But for anybody else that has any of the other potential risks, then it's kind of dependent on what those factors are that are playing into the higher risk.
Gotcha.
What about for like colon cancer and other cancers? Is there a magic number for all? Or
So there is actually a familial risk, or they call it Lynch syndrome, or there are other genetic conditions that can increase your risk for colon cancer also. We have some patients who their children have been getting colonoscopies since they were 25.
Yeah.
So it really does, the recommendations are based on general population recommendations. If you have no other risk factors whatsoever, this is what your risk would be. Right. And it kind of to speak a little bit to you, Steve, like your dad had prostate cancer. And what age was he diagnosed?
He was diagnosed at 60. I was 44.
Correct.
61 and 44.
So your dad kind of fell into that common over the age of 50, the PSAs start getting drawn at age 50. There are some men who have a strong family history of prostate cancer. So dad, uncle, brothers who have developed it earlier in life. And so those PSAs start getting drawn earlier because of that.
Gotcha.
I think it's important to just add that you should always try to get those annual healthcare exams, checkups, because then they can see if there are things that are changing, and they can make those recommendations for perhaps getting some of these additional tests before the actual, time that you're maybe supposed to get it. If they see in your blood and they see in your lab work that there's some strange things going on, then they can make the recommendations.
All right, we're already coming up on time, so I think I think in a future episode, what I would like us to talk more about is because you properly pointed this out, dental, vision, what kind of things that you can do even with those, because people don't really think about cancer in their eye. They don't necessarily think about oral cancers, but those can be very problematic.
Yes.
And so I think, why don't we save those so that we won't have to rush through it. And it doesn't necessarily have to be within Cancer Prevention Awareness Month.
Right.
But let's do that then. And I think we can give that a proper amount of coverage, as well as Tina's episode.
Absolutely.
Separately. All right. So thanks, everybody, for joining. We will be back next Wednesday at noon, and we'll talk to you then.